Hi everyone, I'm your host Claudia. Thank you for tuning in to our weight loss question and answer session. We asked for your questions and today we have Dr. Birkedal here to answer them. I'm joined today with Dr. Christian Birkedal. Thank you so much for being here with us today, Dr. Birkedal.
Welcome.
Dr. Birkedal serves as the Medical Director of Bariatric Services at Advent Health Daytona Beach, where he's primarily located. However, he does serve the entire East Coast Florida division, covering up to Flagler County, including all of Volusia County, as well as North Lake and Sumter counties. Our first question states that I've been struggling with my weight for years and nothing seems to work. How do I know if I'm a good candidate for weight loss surgery?
Well, to be a candidate for weight loss surgery, you have to be over the age of 18. You have to have the motivation to work really hard. Surgery is a great tool, but a lot of hard work is required along with surgery. And for most folks, insurance is the primary way of covering bariatric surgery, so your insurance company would have to have benefits that cover weight loss surgery.
And if someone does meet these qualifications that you've outlined, can you give us some insight on what they can expect from their initial consult with you?
Certainly. So when we see a new patient, I see them for their initial consultation. We spend about 30 minutes going over their past medical history, their past surgical history, their medications, their allergies, family history, to make sure that they're a good candidate for weight loss surgery. Then we go over the different surgical options and help them think through what option is best for them. After we've gone through all that, then we start getting them set up with their education appointments, with their different medical clearances that are necessary. And along with our bariatric coordinators, we map out a plan for how to get them through the process. And then once they're through the whole process, I see them again, go back over everything, and then we pick a surgeon and pick a date.
You mentioned that you would cover the various surgical weight loss options in the initial consult. Can you tell us about what bariatric procedures you perform?
Certainly. We do full range of medical weight loss and surgical weight loss. Surgical weight loss is certainly the most effective, and there are several really good options. There is the laparoscopic sleeve gastrectomy, where through 5 little incisions, we take out the lateral 80% of the stomach. That obviously reduces the volume of stomach, so you're able to eat a whole lot less. Typically, you're eating off a salad plate for the rest of your life, filled with protein and vegetables, instead of a big dinner plate. Also, the sleeve gastrectomy works because we're reducing a hormone that is made in the stomach called ghrelin. Ghrelin is a large part of why folks become overweight and why it's so hard to get the weight off without surgery. The other option that works very well is the laparoscopic Roux-en-Y gastric bypass. With the bypass, we make a little pouch of stomach about the size of your thumb. And then we go downstream, divide the intestines, and reconnect everything, and it kind of looks like a Y when we get done. The gastric bypass works by eating less, but also you absorb a lot less of your nutrients. So therefore you have to take vitamins and make sure you get enough protein the rest of your life with the bypass. Both of them have pros and cons, and we help tailor which one based on what the past medical history, the desires, and the other issues each individual patient has.
Very good. Well, thank you for all of that information. Can you speak to what recovery looks like for both of the gastric sleeve and the gastric bypass, and how the recovery might differ depending on these procedures?
Certainly. Well, the pre-op education process is the same. We typically do 3 months of education before surgery. With surgery, every patient is seen by an anesthesiologist. The anesthesiologist goes over their anesthesia plan. Most of the time that includes a nerve block. The nerve block is done right before surgery, and the nerve block minimizes discomfort after surgery. Then we do the surgery. Once we're done, I immediately go out and talk to family. The patient then goes up to our weight loss surgery floor at Advent Health Daytona Beach. That afternoon, they're up walking and sipping liquids. Patients who have sleeve gastrectomies, if they feel great that afternoon, we get them home that afternoon. If not, we get them home the next morning. And gastric bypasses typically spend one night and then go home the next day. Afterwards, we see each patient back, typically weekly for the first month. We slowly advance their diet as the swelling from surgery goes down and as they're feeling better and getting more energy. We start off with a very low sugar, clear liquid diet, and then slowly over a month, advance them back up to regular food, although it's a salad plate and not a big dinner plate anymore.
Gotcha, very good. Our next community question asks, I'm strongly considering weight loss surgery, but I want to know more about what life looks like after the procedure.
For most patients, life looks great. Their joint pain gets better as they lose weight, their back pain gets better, their breathing better, their diabetes goes away, their acid reflux goes away. If they have a disease called sleep apnea, which is treated with a pressure machine at night, they're able to get off that. Energy typically improves. For women who have trouble conceiving children because of their obesity, typically they get pregnant once they've lost weight. So for most patients, they come back and tell us, oh, I wish I had this done 10 years ago. Obviously, you have to maintain a healthy diet. We strongly encourage you to exercise. But with those, we expect you to return to a normal, although much healthier life, enjoying the things you want to do instead of being controlled by your medical issues.
Absolutely. Well, thank you, Dr. Birkedal, for your time and for all of this valuable information about our bariatric program. We thank you to the community for tuning in with us today and for all of your great questions. We hope that you found this question and answer session to be helpful in taking the next steps towards your weight loss journey. If you'd like to schedule a consult with Dr. Birkedal or want to learn more about our program, you can visit us at bariatricsbybirkedal.com.